Hello, everybody. Okay, guys. I was going to ask you, please go ahead and raise your hand if you can see me and hear me fine. There's a feature there where you can raise your hand, Mr. Mark. So wow, it's near the holiday. I normally have like well over 40 people attending this thing, but I'm just going to give maybe 1 or 2 more minutes here. All right, let's get this started. Do this again. Okay, guys. I don't know why. Having a little technical difficulty here, guys. All right. So listen, let's get started. It's 12:01. This meeting was at, oh, more people are joining us. I don't know why mouse just goes away. All right, so hello, everyone. Please go ahead and raise your hand if you can see me and hear me fine. I'm gonna have to do this in a... Mr. Mark, thank you for raising your hand. Can you all see me and hear me fine? Raise your hand if you can see me and hear me fine. No? We'll check the preference here. Give me 1 second, guys. Yes? Does everyone just have a really slow internet speed here today? Yeah? I'm gonna do this one more time, guys. Please go ahead and raise your hand in that Zoom box if you've done this before, if you can see me and hear me fine. Okay, so is it okay for me to get started? Thank you, Mr. Mark and Mr. Kevin. All right, so let's get started today. And you guys can see this screen okay? We're going to talk about neuropathy and how to reverse the nerve damage here today. Okay, very good. I'm having some technical issues here. My mouse, where I control things, goes away. So let's see if I can do this. All right. So let's talk about neuropathy here today. Thank you very much for allowing this technology for me to connect with you during this lunch hour. Before we get started, I want to introduce myself to you. My name is Dr. An, and I have been a wellness consultant for 18 years now. I need to update the number. We're a member of the Academy of Regenerative Practices. I am a stem cell therapy fellowship program, and also a member of the American Academy of Stem Cell Physicians. I am a doctor of chiropractic. I'm not a neurologist, though I am, as of this weekend, board certified in neurology with the American Academy of Physical Medicine. I have a bachelor's degree in biochemistry. And before I became a doctor a long time ago, I worked for MD Anderson. That was a really long time ago. And on the left here is a picture of my baby who just turned 15 months. Raise your hand if you think she's cute. All right, so y'all can still hear me and see me fine. Just wanted to check on that, okay? So that's what I look like. And you can see me there in the screen there, hopefully. I'm also a published author. I have 2 books, and both of these books are available on Amazon for you to purchase. Or at the end of this lecture, I will tell you how you can request a free copies of this book as well. That's going to be shared with you at the end of the lecture. The first book was called The Pain-Free Knee Book, How to Get Out of Knee Pain Without Using Any Drugs or Surgery. Second book is called Demystifying Stem Cell. It was actually published by the Forbes Authority publishers. They wanted to publish our book. I was also a featured guest speaker on Great Day Houston with Deborah Duncan. If you would like to see a clip of it, there is a link on the bottom where you can copy and watch that interview. Campbell Health Center, which is my clinic, has well over 500 reviews from raving fans in the Houston area that we've been taking care of over the last 20 years. All right, guys, so what are we going to talk about today? We're going to talk about neuropathy, okay? I am going to be giving away gift for participation. When you raise your hand and answer questions, I'm going to be giving away gifts, and it's going to be a very nice gift, okay? So before we get started again, really start talking about neuropathy, we're going to do this one more time. I need to lower everybody's hand. Please raise your hand if you can see me and hear me fine. Thank you, Miss Yolanda, Mr. Kevin, very enthusiastic. Thank you, guys. Thank you. Just wanted to check, okay, that you can see and hear me fine. Thank you very much. So let's get going. So today we're going to talk about neuropathy and what life is like living with neuropathy. And very important, we're going to talk about the 5 most common causes of neuropathy that we have identified from taking care of neuropathy patients over the last 11 years now. Very important again, why drug therapies or pharmacological approach these neuropathy does not work, and our 360-degree approach to neuropathy, whole body approach to neuropathy. Okay. So today we are talking about peripheral neuropathy. So we're not talking about brain damage or the spinal cord injury that can paralyze you, right? So we're talking about damages or the degeneration of the nerve that run in your legs and your feet or your hands and your fingertips. Okay, you have to understand 80% of all neurology is made up of these peripheral neuropathy. So this is not a rare disease. This is a very common disease. And these patients that have this nerve pain, the chronic intractable pain, make up about 20% of all doctors' visits in this country. Okay, so this is a very widespread condition that affects a whole lot of population in this country, with very little that is being done about it other than pain medicine, which we're going to talk about. So a lot of these patients show up to the clinic and they describe their pain as, my feet are killing me, right? I can't do much of anything. I've also met several patients who even went far to say that they were actually contemplating suicide from this relentless pain that is severely affecting them. So you have to understand something, guys, and that is peripheral neuropathy is a chronic degenerative condition that gets worse with the time or as you get older. So that means the longer you have it, the worse it gets. And that is the very definition of what this peripheral neuropathy means. So, and because it is degenerative, we categorize it between stage 1, 2, 3. And, nobody wants to be diagnosed as stage 4 cancer, right? So we do the same thing with neuropathy. So I want you guys to ask yourself what stage of neuropathy you're in. Okay, so when your nerve function is normal, that means you have a nice, good blood circulation that wraps around the nerve, that provides the nerve with the nutrient and oxygen. But when your neuropathy or your blood supplies start going away or start getting damaged, either from diabetes or back pain or spinal injury, then spinal cord problem, then that's when the nerves start breaking down. And stage 1 is when you start having these symptoms here, such as pain, numbness, tingling, burning sensation, cramping, cold feet. And when stage 1 gets really bad, then these patients will typically start experiencing balance issue. They fall a lot, and this makes them come in with very commonly cane and walkers. So we see a lot of patients that actually comes to see us using these assistive walking devices. Stage 2, as it progresses, can cause a severe pain that really subjects the patient to live a very sedentary lifestyle. Some of them may even actually have some ulcerations or infections that doesn't seem to go away and really severely limits the patient's mobility. And those of you, some of you already know that the end result of neuropathy can lead to amputation. Okay, and I'm pretty sure that is not the future where your life want to go as you get older, right? And this is the reason why everybody's attending this meeting. So ask yourself what phase of neuropathy you're in. So let's dive right into what are some of the causes of the neuropathy. So well, the number one cause in our office that we see most frequently is diabetic neuropathy. Go ahead and raise your hand if you're diabetic, type 2 diabetic. Mr. Mark, I am going to send you a gift. I know you have been getting emails from me. So writing your name down here. I know you've been getting emails from me. Please go ahead and email me with a good mailing address and I would like to ship you a gift. Okay. Thank you very much for participating. Everybody still with me? Yes. All right. So Mr. Mark, type 2 diabetic, this probably make up about 30 to 40% of all our patients that we see. Patients that have this metabolic syndrome, right? Their body has trouble processing blood glucose. And what is the reason why? What is the reason being diabetic causes neuropathy? You have to think of what happens to, what happens when sugar or candy melts in your hand. It becomes very, very sticky, right? When you become exposed to sugar. So think of it this way, when your blood is constantly being exposed to excessive sugar or glucose, your blood actually becomes a thick sludge of substance instead of nice flowing flow, right? So in turn, being diabetic causes you to have a circulation problem, and especially the parts of the body that is away from your heart and feet or the toes. This is the reason why diabetic neuropathy typically starts in your feet and the toes first, because it is the furthest away from your body. Okay, and male patients or men also have to think about, well, what else dangles off my body and it's kind of away from my heart. So a lot of these patients also tend to have ED as well. Okay, so about 30 to 40%, 35 patients that we see in our office have diabetic neuropathy, and we have a very good success rate with these patients. All right, cause number 2, and this make up about 60% of our patients. And I'm assuming a lot of you in the audience are middle-aged, or even more of you are senior citizens, right? Raise your hand if you're senior citizens. 65 and plus. Ms. Pat or Mr. Pat? I'm gonna send you a gift, okay? So either you have a really fast internet speed, you're participating, I'd like to send you a gift to Mr. Pat or Ms. Pat. Please email me with a good shipping address, okay? All right, so those of you who raise your hand, I'm pretty sure a lot of those seniors in the room, y'all used to be taller, right? When you're younger. And as we get older, we tend to lose that height. And what exactly are we losing as we get older? And that is the disc or the cushions in between the vertebrae. See, I don't know why mouse tip goes away. It's really bothering me, but all right. So the cushions or the sponge in between the vertebrae as we get older, they dry out and they get smaller. And this is what makes us shorter. But it is also what causes or contributes to the neuropathy. So for example, if it's the nerve number 5 in your lower back, it doesn't just stay in your lower back. As you can see in this diagram on the left, nerve number 5 wraps around parts of your leg and travels all the way down to your toes. Just yesterday, I had a patient whose toe has been completely numb and they're now cold and purple and blue. And in her case, it was a chronic lower back pain that was contributing to this problem. Okay, so this is bigger than actually diabetes. So about 60% of our patients have a neuropathy caused by spinal issues. And this is part of the reason why we may end up recommending spinal rehab as part of the neuropathy care as well. And unfortunately, more commonly, we see patients who's had back surgery because they had a debilitating back pain, and maybe the surgery helped them with the back pain a little bit, but now they have just really like debilitating pain that travels down all the way down to their legs. We're almost talking cases of failed back surgery as well. And we see, unfortunately, those patients quite frequently as well. Cause number 3. Who here can chat in here the vitamin? We're going to talk about chemo-induced neuropathy, but who here can, oh my God, I'm just having a lot of issues here. All right, so who here can tell me the neuropathy that, or the vitamin, sorry, I'm a little distracted, vitamin that has a very important function in nerve function. B vitamin, Miss Lisa, very good. All right, so it's B vitamin, and you have to understand, B vitamin is not just one vitamin. Someone in the room mentioned B12, but B vitamin is really a complex, okay? So B vitamin complex, it's made up of B1, B6, B12, niacin. They're all branches and families of B vitamin, okay? So B vitamin has a very important role in the nerve function. And there is a reason why standard American diet is called SAD, Standard American Diet, SAD, is because typical American diet tends to be very, very rich and high in calorie and very low in nutrients, such as B vitamin. So even though you may be thinking or you're eating proper diet, your body could be just suffering from generally nutritional deficiency, and that can also contribute to the cause of neuropathy as well. Here we are looking at a photo of a gentleman who obviously has a problem with alcohol, right? You don't necessarily have to be an alcoholic to develop B vitamin deficiency, but if you've been drinking, what is a glass or 2 wine every night for a very long time because it's good for your heart, we can debate that, okay? Then you could also be suffering from B vitamin deficiency as well. And by the way, what the doctors commonly order as like a serum or blood B vitamin measurement is notoriously not very accurate, okay? And if anyone here is vegan or a vegetarian diet, then 80%, more than 80% of those patients also have B vitamin deficiency. And the scary thing is that when they get a test done at doctor's office, it's going to say that they have normal level. Okay, so B vitamin deficiency could also be contributing to the cause of the neuropathy. We also have patients just that have a straight up nerve damage, right? So including myself and a lot of you in the room, sit in front of a computer and just type on the keyboard all day long or use a mouse all day, then it can end up causing a nerve damage right on the nerve that runs in the middle of your wrist. This is called a median nerve, and the median nerve damage is more commonly called carpal tunnel syndrome, right? So, or we also do have patients who have like, they broke their bone or ankle and then the nerve got injured. So those are the cases of repetitive or, traumatic straight up nerve damage. Yesterday, I had a patient who had a total hip replacement and ended up damaging a femoral nerve, which was just giving her a grief. The doctor told her that the function was going to come back in 6 weeks. It's been 6 months, and the nerve pain is actually getting worse. Okay. Someone in the audience asked me about what about chemo and radiation therapy induced neuropathy. We get a lot of those patients as well too, guys. And chemo and radiation, it kills or shrinks the tumor, but they're very toxic, especially to nerve. A lot of these pharmaceutical chemotherapy drugs are neurotoxins. So we get patients who survive cancer 5, 6, even 10 years, but neuropathy that started with the chemotherapy just never goes away and tends to get worse with time. And one of our treatment that we recommend is the same treatment that is also recommended at the Cancer Treatment Centers of America in reversing chemo and radiation induced neuropathy. Okay. So rest assured, guys, if I can do this, Our treatment, which is what we're going to talk about, how we reverse it, is not, we're not just going to throw some, pills or drugs at you, which we're going to talk about as well. These 5 most common causes that I just addressed with you, such as being diabetic, compressive pressure on the spine, nutritional deficiency, and nerve damage. Our treatment is going to address all of these causes. And this is why we have a wildly successful neuropathy results. Special mention. Pay attention, guys. Special mention. There are some drugs and compounds that we are very commonly exposed to that has peripheral neuropathy as the #1 side effect. And that drug is actually cholesterol-lowering drugs. Okay. So we have 15 people in the audience. Raise your hand if you are currently taking cholesterol-lowering drugs. I normally see about 1/3 of the room. Okay. So listen, I'm going to give you some health tips. Okay. If you are taking cholesterol-lowering drugs, there is a natural supplement that you can take that can offset the side effect of the cholesterol drug. And that compound is called coenzyme Q10. Okay. And I'm going to, because somebody's always going to call my office and ask what that was. I'm going to chat that in the chat box. And it's coenzyme Q10. I'm chatting for you. And it's simply called CoQ10. And this is not a prescription supplement. You can actually buy it anywhere, guys. You can go to CVS, you can go to Sam's Club, you can go to Costco. They will say a big jar of it, okay? And this is a antioxidant compound that can greatly reduce free radicals in the body. It has a great cardioprotective effect as well too. So anybody with high blood pressure, heart problems should also be on it as well. But if you are taking cholesterol lowering drugs and is also taking statin medication, then you need to be taking not 200, not 400, but you want to be taking 600 plus up to 1,000, up to 1,000 milligrams. Okay, so typically the coenzyme Q10 comes in a 1 little capsule, has about 200 milligrams. So you want to be taking one every, 3 times a day with every meal. So 1 in the morning, 1 with lunch, and 1 in the evening. And this is how you saturate your whole cells. So these coenzyme Q10 have the protective effect. It can offset some of the damages of the statin medicine that it's doing to your nerve system, and could even potentially ease off the neuropathy symptoms as well. Okay. Couple of other things that's not on the slide that I want to also mention to you. Fluoride. Listen, guys, fluoride is a nerve toxin. Okay. So if you are suffering from neuropathy, you need to go and toss out your fluoridated toothpaste. Houston, city of Houston water is also fluoridated. So you better not be drinking tap water. So you want to avoid everything that contains fluoride. Do you know what else contains fluoride? The most commonly prescribed drugs, about a list of 300, including Cipro. Think about all the women in the room. Every time you had a UTI, that's probably what you're given. These are what's called fluoridated drugs. So just being on a prescription drug could be contributing to your neuropathy symptoms, or if you have a history of taking these fluoridated drugs, I mean, just Google it. Google list of fluoridated medication. You're going to get like a list of 300. Okay. So tap water, fluoridated, you want to avoid that. What else is also nerve toxin? Aspartame. So anybody in here that drinks or consumes diet something, diet Coke, diet soda, yes, you can take coenzyme Q10 as a anti-aging, wellness. But anything that contains diet, aspartame, artificial sweetener, Splenda, they are nerve toxin. Okay, so you want to stop taking it. It's really bad for you. So 3 tips that I've given you: being on coenzyme Q10 and getting rid of fluoride from your body. and also, avoiding drugs and medications that contain fluoridation and artificial sweetener or aspartame. Okay, so let's see if let me do this. All right, so I went over that. So raise your hand, guys, if you've ever been to any kind of doctor for this neuropathy, like family medicine doctor, neurologist, Baylor College of Medicine. I mean, everywhere we get patients that's even been to Mayo Clinic. So more than half of you have already been to some kind of doctors for this neuropathy, right? So even before I speak to you, I can tell you how that visit went. So you go and tell the doctor, whether it's a neurologist or family medicine doctor, that your feet are numb, they're painful, they burn, you describe your symptom. The doctor may or may not have ordered some kind of testing. And it's going to be one of the two. It's called a test called NCD and EMG testing, where they put needles into your legs and have you wiggle around to test the electrical activity. Not a comfortable test, by the way. It's very memorable. Or the doctor might have taken a very small piece of your skin in your leg for what's called small nerve punch biopsy. Whether the doctor ordered these tests or not, the end result of that visit is going to be the same. And what is that end result? It's some kind of pharmacological recommendation, more frequently than anything, probably a Neurontin or gabapentin, right? I mean, I know exactly how those visits work. You go see the doctor, they order some kind of test, and then they're going to tell you or diagnose you as having a neuropathy, and then they're going to tell you take this gabapentin. There's nothing else that can be done about it. Okay? Raise your hand if I just describe exactly what happened to you. It doesn't matter whether you went to your family medicine doctor, the top neurologist at the Baylor University, or how about even Mayo Clinic. We actually have patients who's been to Mayo Clinic. Okay? So I'll be very surprised if your doctor told you anything else. All right. So with that, let's talk about gabapentin, Mr. Kevin. Let's talk about gabapentin. So gabapentin or Neurontin is the most commonly prescribed medication for peripheral neuropathy. And you have to understand that it is not a peripheral neuropathy drug. Okay. And it is actually a seizure medicine that is being used off-label for pain. And how does gabapentin prevent seizure for someone who's actually having seizure? Is because it's going to greatly slow down the brain's activity. How would you like to have your brain's activity slow down greatly? And because of that, if you take gabapentin, your chance of developing memory problem, senile dementia, age-related dementia, Parkinson's, Alzheimer, go up significantly. I can see the quietness in the room because it normally starts out by what, 200-300 milligrams a day. And the more you go to the doctors telling them about your neuropathy that's not getting any better and it's getting worse, they're just going to keep on upping that gabapentin. I have seen patients who's taking up to 3,200 milligrams a day. That is insane. All right. So what are some of the other side effects of gabapentin? Weight gain, dizziness, fatigue, tremor, double vision, difficulty speaking, and drowsiness. How about this? Did you guys know that gabapentin comes with a black box warning from FDA? That is the highest warning FDA can issue to any drugs. All right. So gabapentin has a black box warning for its potential of causing a serious breathing problem. I actually have several patients who said that they woke up in the middle of the night gasping to breathe while they were taking gabapentin. How about this? You know how Google completes your search when you type something in? So this is what Google completed the search for me. Well, number one thing that popped up is gabapentin linked to growing number of suicide attempts. Can gabapentin make you depressed? Does it cause mental confusion? These are very common side effects that I hear from my patients that come and tell me that they couldn't take it anymore because it was causing them these side effects. Who knew that gabapentin did all this? Raise your hand if you did. Is this information good for you so far? Miss Janet, I'm gonna send you a gift. Thank you very much for raising your hand and participating. I'm building a gift list here. All right, please email me with your address. All right. What are some of the other drugs that is very frequently prescribed along with gabapentin? Oh, I don't know why, guys, but antidepressant, Cymbalta, is also very commonly prescribed for this neuropathy pain. Antidepressant, how about that? I don't know what to think of it. Is your doctor trying to tell you that your pain is in your head? And because of these failed interventions for this neuropathy, a lot of these patients also come in taking really heavy-duty painkillers such as Lyrica, which is controlled substance, Oxycontin, Vicodin, which opioid pain medicine is now killing. I mean, depending on the statistics, that you read, it's killing like 175 people a day, or like 1 in every 11 minutes. Okay, so is it time for you to demand that you get other options other than just the pills being thrown at you? Okay, so I have good news for you guys, and that's what we're going to talk about. How do we actually reverse the nerve damage or stop the nerve damage without using any drugs or surgery in our office? Okay, so this is the good news, guys. All right, pay attention. So number one, the backbone of our neuropathy treatment is called using a treatment or method called regenerative medicine. Okay, you have a degenerative condition that gets worse with the time. What does regeneration then? Regeneration is using your body's natural ability to heal. It's the healing ability that we all had as youngster, right? That we gradually lose as we get older. It is your ability to replace to a certain level to damage the cells with a healthy one, and restoring your body's normal function so it can, do its job and what it's supposed to do. Everybody here has probably heard of stem cell therapy. This is not a course on stem cell therapy, so we're not going to talk about that. But there is one form of stem cell therapy that I'm going to talk about, and it's called the platelet-rich plasma therapy, or in short, it's called the PRP. Raise your hand if you've heard of PRP therapy or plasma therapy. So it really makes a big part of our neuropathy treatment, okay? So let me skip over some of these. So how is this platelet-rich plasma therapy is done? We are going to take 1 or 2 tubes of blood from you, just like how you get your blood drawn at a doctor's office for a regular blood checkup. So we're going to take your blood and we're going to centrifuge it and separate out the plasma from your red blood cells. So in majority of the patients, your plasma is actually going to appear clear yellow liquid, just like what you're seeing on the right side. In some patients, it's a little more whiter, which always freaks me out, but everybody has different makeup in their blood. But we're going to be taking that plasma and inject it back into the major nerves that run in your legs and your feet, okay? This is platelet-rich plasma therapy. It is using your own body's ability to heal, repair, and grow, and concentrates regenerative properties found in your own blood. It also contains what's called exosome, which is also a big name in regenerative medicine. Ooh. Okay, going back. Hopefully you didn't see that. It's lunch hour. Hopefully nobody's eating lunch in front of the computer, which I do that all the time. But graphic photo warning, guys. Graphic photo warning. So on the very left here, we have Mr. Gary. He was 73 years old when he came to us. And I wish I would have taken a bigger picture of his foot. This is the right side of his ankle, inside of his ankle, just above that bone, ankle bone. Okay. So he had that's about 2 inches long, about an inch wide, and then about half an inch deep ulcer that he developed, and he is diabetic. Do you want to know how he got that ulcer? His doctor at the VA hospital did what's called a small nerve fiber punch biopsy. So where they take a small piece of his skin and do a biopsy to diagnose him that he has neuropathy. Well, you know what happens to diabetic patients, even if they get a smallest scratch, it has the potential of becoming a huge infection and like never heal, right? Well, that's exactly what happened to him. So he's had it for almost 3 years and severe neuropathy. He wakes up 2 or 3 hours every night, can't go, I mean, doing the simple things around the house. He can't go grocery shop because he has to make like 7, 8, 10 stops, and just miserable. And it's been like that for almost 3 years. And he was going to the VA hospital with an appointment with a wound care doctor every month. And really my only question was, what are you checking? Like, are they checking to see if it's still there? You know, because they just put a piece of gauze on him and just let him go. On the right here, the second photo is actually 2 weeks after his first PRP injection. And number one, the wound's healing, it's granulating, it's becoming more shallow, it's closing down. But can you see the difference between the skin, how inflamed it was? And now he's starting to actually get his normal skin tone back. His symptom and the throbbing neuropathy has already eased off quite a bit. And this third photo is the 4 weeks after the second plasma injection, and we ended up completely closing his wound and greatly improving his diabetes as well too. And the patient reporting well over 80% reduction in his symptom. He's able to sleep throughout the night and, you know, walk around and do things around the house. I mean, he was super satisfied. So raise your hand if you think that's really cool and you want something like that happen to you as well. All right, very, very good. Very good. All right, so let's move on. Let's see. Second way we can restore the nerve function is by using what's called red light therapy or infrared red light therapy. And I have a device that I personally designed myself. I was using another company's product. I was dissatisfied with it. So I actually designed my own red light therapy called Neurolux Light. And it is what the NASA discovered about 40 years ago is that infrared light programmed at a certain wavelength, mostly in 680 and 880 nanometer, has the ability to build a new blood flow. Remember the photos earlier? Build a new blood flow and provide your body with that area where being treated with increased level of oxygen. This is called angiogenesis. Okay, so red light therapy done at a certain frequency has incredible ability to promote blood flow. It's called nitric oxide. You know, improve your blood circulation as well. So we may recommend this as a home therapy, again depending on the patient's situation. Remember, what's the reason why I'm no longer 6 feet tall and only 5'1"? It's because my discs are drying out. I really am 5'1". I was never 6. My mom used to be 5'1", she's 4'11", so I'm probably gonna end up being small, short lady like my mom. But anyhow, after taking X-ray of your spine, if you are showing degenerative changes over your spine, we are going to be recommending spinal rehabilitation as well. All right. Let's see, where are we? Okay, so remember I also told you diet and nutrient, providing your body with the proper nutrient has a huge role in reversing neuropathy as well. So who here, raise your hand if you take vitamin in here? Whole lot of you, right? I mean, I think almost everybody takes vitamin. I'm a big fan of supplement, by the way. Okay, I'm always researching the cleanest and the most absorbable nutrients, supplements all the time. And there is a small issue with taking oral supplement. Number one, you just have to make sure they're taking a very high quality, good absorption nutrient. Okay. You cannot raise your hand there. I am so sorry. You're missing out on the gifts. Anyhow, going back to the nutrient, when you take a oral, like a supplement, when they land in your stomach acid, which is about pH of 2, is going to, that's if you're healthy, pH is going to destroy a vast majority of that. And we have what's also called the first bypass effect of the liver, where your liver processes vast majority of, you know, these nutrients that you've supplement that you paid for. You're actually lucky if you end up absorbing about 15 to 18% of this supplement that you paid money for. And there's one way to deliver 100% of the nutrient that we want to deliver to your body, and that will be by providing it to you, mixture of vitamins and cocktails through intravenous therapy. Okay, so when we can provide this nutrient through IV, we skip the liver, we skip the kidney, liver and stomach, and, you know, provide your body with a full minerals and cocktails, minerals and supplements and vitamins that we want to provide to you. Okay, a lot of you guys take calcium. In my career, I have seen several cases. I mean, we take a lot of x-rays in the office too, but I have seen calcium, undissolved calcium pills showing up in colon, like clear as the day, like outlined like a pill. It's kind of, it's almost comical. I call it expensive urine or poop, right? Because you just pay for it and take it and it goes right through you. All right. So IV nutrient therapy delivers 100%. The formula of the IV therapy could change depending on your background and what you need. I'm almost done here, guys. It's 12:41. Thank you very much for staying here with me. Raise your hand if you've learned a lot in the last 40 minutes. And some tips that you can start implementing in your life to improve these neuropathy symptoms, right? Is that... Thank you very much, guys. All right, so listen, with this information that you have learned here today with me, you can do 3 things. One of the 3 things. Number 1, do nothing. That was a good information. And then do nothing. Number 2, option number 2 is continue doing what you're doing, which is what? Probably popping pills, neuropathy, gabapentin, Cymbalta, or Lyrica, right? Option number 3 is what? Do something different. I've always been a student of personal improvement, how to be more productive. I consume a lot of this information and books. And one recurring theme on all of it is that in this age of, Mr. Kevin, that is correct. In this day and age of information, cheap publication, we do not collectively suffer from lack of information, all right? We suffer from lack of action. What makes you think that your neuropathy is just going to get better one day? And especially from continuing to popping these prescription pills, if you think that your neuropathy is just going to get better one day, doing the same thing over and over again, magically, you're insane. Let me tell you, you are insane to think that. How about tell that to 2 people, family members in a family that I know that have lost their feet and the leg below their knee, below knee amputation. I actually know 2 people, okay? So what is the definition of doing the same thing over and over again and expecting a different outcome? You're insane. It's called insanity. Thank you, Ms. Sue, for answering. Please email me. I'm writing your name down here. So I have 4 people who's won a gift with me so far. Good mailing address for me to send a gift to you. Very nice gift to you. So I have, those of you who stayed with me so far, I have a special opportunity for you to come in to see if your neuropathy is still reversible, because up until to a certain point, neuropathy is not a reversible condition. Remember, I told you it's a chronic degenerative condition. It is not a pleasant conversation to have with a patient. But once or twice a week, we do have to turn a patient away because they've come in too late, okay? And this is an opportunity for you to come in. Oh, don't type your, here, let me, Miss Janet. All right, I saved your address, okay? So listen, I'm going to reply to the chats and questions when I'm done here. I'm almost done, okay? So this is an opportunity for you to come in to see if your neuropathy is still reversible or not, okay? We're gonna do a very thorough consultation. We're going to do a very thorough neuropathy examination that you've never gotten done before, guarantee you, all right? We're gonna take some thermography imaging of your feet. We may also take some necessary x-rays if you have a history of back issues. And that is an opportunity for you to find out if this is something something that we can take care of you or not. Some of you have asked in the chat that if this treatment is covered by insurance. So that's a very good question, and I'm going to go over that with you, okay? Remember, I described to you exactly what happened when you went to see your doctor for this neuropathy, right? So some type of office visit or a doctor's visit, and then they run some tests, and then they give you pills. Probably all covered by insurance, right? And guess what? Your insurance will even cover your amputation. But what we're trying to do is not just throw some pills at you. We're not going to cut your leg out for sure. We're actually reversing these nerve damage by making you healthier. And unfortunately, those services are not covered by insurance, and no insurance companies, especially covering treatments like regenerative medicine right now, okay? This is an example of a thermography imaging that we took of a patient. You can tell right away which leg is the worst one just from looking at this, right? If you are healthy, you have a good nerve and blood flow, you should have a nice red picture, color showing up here. This patient particularly has a greatly reduced blood flow to most of the toes and the foot and parts of the leg, and now it's spreading above the leg as well too. All right. This is what's called a Toronto Clinical Nerve Damage Score assessment that we do. And obviously, you do not want to have any black parts showing up like that on this test, okay? What else are you going to receive when you come in for the evaluation? And I have my own formula of very high potency hemp cream. It is crazy popular at the clinic. It will give you a temporary relief, natural temporary relief of any pain that you may have. And also my books. You can buy it off Amazon, or you can get it for free when you come in and set up the appointment. So what are you all going to receive? What is the webinar special? Okay. And that is an opportunity for you to come in and get the consultation, neuropathy evaluation, any necessary x-rays. And I'm going to change out this B12 injection into actually a full IV vitamin therapy. Okay. So let me change that out. That's actually, we charge $150 for that, okay? And especially at this time of pandemic and COVID, it's got vitamin C in it, great for your immune system, okay? High potency hemp cream, my pain-free book. I don't know where this 13.10 cents come from Amazon. That's what they have it listed on. Demystifying Stem Cell book, which is a hard copy book, is also $19.99. This is an over $600, almost what, $700 value for staying with me through this whole webinar and spending your lunch hour with me and allowing me to use this technology to connect with you guys. I have all of this available for you for $47. Raise your hand if that sounds really good. Okay. there is a fine print. The fine print, just 3 rules. Number 1, if you are married or have a significant other, you must come in with your important person. And I'm going to tell you why. Remember, going back to what we have discussed so far, we're not just going to throw some pills at you, right? We're going to take care of your whole health, whole body, using nutrition, different technology and treatment. And some aspect of our care may involve your spousal support, all right? And quite often, this thorough examination that we have to do, I know your husband or wife know that you're having this issue. It is an eye-opener for them because they actually get to see how severe that nerve damage is, okay? So that's rule number 1. Rule number 2, this appointment must be made in the next couple of hours because I only have a few appointments available for those of you who attended this webinar with me. And I'm going to lower the hand, okay? And in order for us to reserve that appointment, 2-hour appointment for you, you must take care of that $47 with my staff over the phone, all right? I used to give these appointments away for free. Can you imagine what happened when I did that? Can you imagine what happened? People are not showing up. I'll reserve out like 2 hours of my doctor's time and people are not showing up and everyone got so upset. Not to mention, I mean, look, we're very busy. It's 2 hours of our time that we could be spending to take care of other people who actually need help. All right. So in order for us to go broke, Mr. Mark. Yes, Miss Janet, no show up rate was very high. So in order for us to reserve your time with us, you must take care of that $47 with us, with Angie or Miranda when they give you a call. So let's do this. Go ahead and raise your hand if you want Angie or, yeah, Miss Janet, I know it's unfortunate. Right, go ahead and raise your hand if you want Angie or Miranda to give you a call and to schedule this appointment. And you can also chat in the chat box here. You want to be contacted and leave your phone number. And I'll have Angie or Miranda. We'll give you a call almost right away as soon as we're done here. All right, you guys are fun and making me laugh today. All right. So why I would like to see every one of you in here is because reason number one, I mean, the life that these people drive, you guys described to me, like you can't do this, you can't do that, you don't do this anymore. I mean, it's very sad, right? So if you don't try something new, then you will never get to find out what life is like not having this problem. You're just gonna completely miss out. Some of you had pain for so long that you can't even remember what your life used to be when you didn't have this neuropathy, when you could actually walk around and do things and not feel miserable every day, okay? Reason number 2, neuropathy is a degenerative condition that gets worse with the time, right? That means the best time to reverse it is not 3 months later. The best time to reverse it is right now. When you return to us 3 months later, you may no longer qualify for the treatment. And believe me, it does happen, okay? Reason number 3, I believe life is about being happy, living your life, doing the things you like doing. And we have some patients who retire from working, putting off neuropathy, dealing with it for a long time. But what kind of retired life is that when you can't travel and do much of anything? And with the offer that I'm giving you here, you're getting far more than $47 what we're charging here. So you literally have nothing to lose. And I think you can agree with that. We're located off I-10 and Campbell Road. Once you schedule the appointment, Angie and Miranda will text you our Google Map listing. We're super easy to find, okay? And that's all I have for you guys. Let's see, I'm gonna go back. Somebody had active cancer. That depends on where you are with the cancer. So just come in and we'll let you know. We'll do an evaluation. You may not qualify for certain treatment, but there are things that we can do for current active cancer patients as well. Here is a picture of my baby and me thanking you for spending your lunch hour with me. And again, allowing me to connect with you using this technology. And I very much look forward to meeting everyone at the clinic. And I'm going to just stick around for just a minute or two. And those of you who won the gift, Mr. Mark, Pat, Janet, I have your address, Miss Janet, and Miss Sue. I know you've been getting emails from me, so go ahead and email me a good mailing address, not email, and I will send you a gift for being an active and enthusiastic participant in here. And I look forward to seeing everyone at the clinic. Thank you very much, guys. Thank you, guys.